Welcome to Review Central. This is NCLEX Reviewer No. 1, featuring questions on basic care and comfort. This reviewer is intended for those who are eyeing, or are set to take either the NCLEX-PN, or the NCLEX-RN. There are 10 questions featured on this reviewer. All questions are modeled on actual questions that appeared on previous NCLEX exams. Now let's begin. Question number 1. A 12-year-old child has a fractured ulna and radius that is treated with open reduction and internal fixation. The surgeon is worried that the procedure was long but did not do a fasciotomy. What is the first sign of compartment syndrome? A. Pallor. B. Paresthesia. C. Pain. D. Loss of pulse. The correct answer is C. Pain. Severe pain is usually the first sign of compartment syndrome. Severe pain at rest or with any movement should raise suspicion of the syndrome. By the way, paresthesias are not reliable as a first sign. Besides pain, the patient may feel that the limb is feeling tired or tense. Always compare the affected limb with the unaffected limb. Question number 2. Which of the following methods is used to maintain oral hygiene in a patient who is kept NPO? A. Drinking fruit juice. B. Gargling. C. Sucking on ice cubes. D. Drinking water. The correct answer is B. Gargling. NPO means nothing by mouth. An NPO patient cannot be given any liquid. On the other hand, mouth care is appropriate, thus, gargling is the proper method to maintain oral hygiene. Question number 3. Which of the following is correct regarding weight, nutrition, and exercise before and during pregnancy? A. Weight gain recommendations during pregnancy are based on BMI of 25 to 35. B. Pregnancy requires 500 extra kilocalories per day, which can be increased based on activity levels. C. Infertility is more strongly associated with being underweight, that is, BMI of less than 19. D. Being underweight, or having a BMI of less than 19, is not a risk factor for preterm birth. The correct answer is A. Weight gain recommendations during pregnancy are based on BMI of 25 to 35. Only 100 more kilocalories per day is recommended in the first trimester and 300 kilocalories extra per day in the last 2 trimesters. It is breastfeeding, not pregnancy, which requires 500 extra calories a day. Therefore, B is incorrect. A starting BMI of 19 or less is associated with preterm births, both small for gestational age, with odds ratio of 1.69, and normal for gestational age, with odds ratio of 1.34. Therefore, C and D are both incorrect. Question number 4. A young woman has been placed on strict intake and output measurements after a recent kidney operation. When emptying the urinary drainage bag, certain steps should be followed to ensure accurate measurement of output. Which of the following is not a key concept to remember when measuring and documenting I and O? A. Elevate drainage bag above the level of the heart, to allow for accurate flow and ease of measurement of urine output. B. Leave drainage bag and tubing off the floor and below the bladder, ensuring it is attached to the bed frame and not the side rails. C. Empty contents of urinary drainage bag without contaminating tubing, or drain spout and avoid touching the end of the tubing to the graduated cylinder or bedpan. D. Use standard precautions when providing care and follow infection control standards. The correct answer is A. Elevating a drainage bag above the level of the heart is not a correct concept and procedure to remember. Drainage bags should always be kept below the bladder or level of the waist to facilitate gravity drainage. Ensure standards or key concepts are met while emptying a urinary drainage bag and recording accurate output by following certain key steps. The first step is always to identify the patient using two patient identifiers. Greet them with a smile by their chosen or given name and introduce yourself. Provide a brief explanation of what is about to take place and why it is important. Put on gloves. Always wear gloves while coming in contact with a urinary drainage bag, graduated cylinder or urine-filled container. Place graduated cylinder or bedpan on drainage pad or towel placed on floor, and empty all contents of drainage bag into graduated cylinder or bedpan. Do not touch the tip of the catheter or end of tubing to the cylinder or bedpan or urinal. The end of the catheter should remain sterile and free of bacterial contaminants. Else, a life-threatening urinary infection may develop. Ensure clamp is closed and placed back into pocket, if available. Protect the clamp to decrease any chance of it opening, or being dropped onto the floor. Place graduated cylinder on a flat surface that has been covered with a cloth or pad or barrier. Read graduate amount at eye level. If a bedpan was used, pour urine in graduated cylinder over a toilet or hopper, and then place on flat surface and read at eye level. Question number 5. Which of the following statements about sharps disposal is incorrect? A. Sharps containers should be accessible to staff but not patients. B. Sharps containers should be discarded, not emptied. C. Sharps should be discarded by the user and not handed off. D. Retractable needles are an unnecessary expense. The correct answer is D. The statement, retractable needles are an unnecessary expense, is incorrect. In fact, retractable needles should be used whenever possible. Sharps containers should be out of reach of children, but it is rarely practical to have them out of reach of adults. Never empty a sharps container. They should be discarded before they are full. Recapping needles should be avoided, but if done at all, a one-handed technique is preferred to a two-hand technique. Question number 6. Feeding tubes are placed to provide which of the following? A. Decompress the stomach. B. Nutrition. C. Fluid. D. Air exchange. The correct answer is B. Nutrition. Feeding tubes are designed for nutrient replenishment. Question number 7. Gathering necessary supplies is paramount in carrying out the task to facilitate the use of a bedpan. What supplies are a requirement for this skill? A. Regular or fracture pan. B. Hand hygiene products. C. Soiled linen hamper. D. All are necessary supplies. The correct answer is D. Some supplies that may be needed to carry out the task of placing a patient on a bedpan are as follows: bedpan, fracture or regular with bariatric considerations, personal protective equipment such as gloves and gowns if isolation requirements call for their use, and hand hygiene products, soap, and a basin of water. Linens such as washcloths, sheets, privacy blankets, disposable wipes, privacy curtain, incontinence pads, and diapers may be needed. Powder may be needed if advised per policy, and no contraindication for use exists. Also, toilet paper and trash can may be needed. Other supplies that may be needed are soiled linen hamper and location of the dirty or soiled utility room, graduated cylinder to measure output, if a requirement, and stool containers if cultures or other fecal tests are part of the order set. Question number 8. Which of the following is the best evidence of healing of a pressure ulcer? A. Lack of purulence. B. A non-erythematous space. C. Epithelialization. D. Lack of a fever. The correct answer is C. Epithelialization. Epithelialization of the ulcer is the best clinical evidence of healing. Epithelialization is defined as a process of covering denuded epithelial surface. The cellular and molecular processes involved in initiation, maintenance, and completion of epithelialization are essential for successful wound closure. Question number 9. Who is best able to assess the need for pain medication? A. Patient. B. Pain consultant. C. Nursing staff. D. Physician. The correct answer is A. The adequacy of pain medication is based on patient self-assessment. The most efficient self-assessment is with numeric rating system. Question number 10. This is the last question for this reviewer. Which is true regarding recommended diet in nephrotic syndrome? A. No added salt is recommended. B. Supplemental protein has been found to be helpful. C. Fluids should usually be restricted. D. None of the above. The correct answer is A. No added salt is recommended. Nephrotic syndrome is a kidney disorder that causes your body to pass too much protein in your urine. Nephrotic syndrome is usually caused by damage to the clusters of small blood vessels in your kidneys that filter waste and excess water from your blood. For nephrotic syndrome, fluid restriction is not usually recommended except when edema is severe. Added protein has not been found to be helpful either. You have just completed NCLEX Reviewer No. 1, which featured questions on basic care and comfort. If you wish to watch more NCLEX reviewers on basic care and comfort, check out our NCLEX Basic Care and Comfort Reviewers playlist. Check out also our other NCLEX playlists for other reviewer topics. If you haven't done so yet, please don't forget to subscribe to Review Central, and click or press the bell button to make sure you get notified whenever we post a new reviewer or other review materials on this channel. Please like if you find this video useful and feel free to share to anyone who may also benefit from it. Good luck on your NCLEX.